course, there's other things that can show up like little bumps on your nipples. It's not just these Montgomery tubercles, which are probably the most common that most just about every woman has. Hi, I'm your local OBGYN. I love women. And if you want more information like this, follow here or on YouTube for long format. So, Montgomery tubercles are benign, and so are a bunch of the other things that I am going to mention that can show up as lumps and bumps on that pink or brown area of your areola. There's something called a milk bleb, and these look like little white raised dots. I kind of think of like a whitehead that like accidentally like fills backwards with a little bit of milk, most commonly during lactation. They can be a little bit irritated if they're there, but again, benign, just annoying, warm compresses. Secondly, there is something called an epidermal inclusion cyst. We can see them on our labia as well. They're these like bumpy things that can get hard and sort of firm, and they may open and rupture some like thick or like juicy looking stuff that comes out. They're not quite infected. It's kind of like a backed up duct of like epidermal debris. There's also something called milia, which are kind of like whiteheads, and if you squeeze them, you could actually see white gunk come out. And then there's something called a nipple adenoma. They can make you a little nervous because they can look a little bit funny, but they're also just kind of like lumps and bumps of the tissue of the breast that are benign. Now, there's a lot of other things that can happen to our breasts. If you're concerned, get it checked out, because somebody like me who does breast exams all day can tell you when to worry and when not to.